Welcome back to Mayo Clinic Radio. I'm Dr. Jake Strand.
And I'm Tracy McCrae.
A new study recently found that the number of children diagnosed with attention deficit hyperactivity disorder, commonly known as ADHD, has increased dramatically in the United States. As reported in JAMA Network Open, the number of children diagnosed with ADHD rose from 6.1% in 1997 to 10.2% by 2016.
Greater awareness of the condition may be one factor, but what else is contributing to the rise in ADHD cases? Here to discuss is Mayo Clinic psychologist Dr. Michael Zaccariello. Welcome to the program, Dr. Zaccariello. It's really nice to meet you.
Thank you. Thanks for inviting me.
Well, is there more ADHD, or are we just getting better at finding it, or are people just more aware of it in general?
You know, in reference to the study, I think the authors understandably highlight some issues with that. The way that ADHD was identified in the study was simply asking parents if a doctor had ever suggested that their child had ADHD or ADD. I submit to you that that's probably not the more common way to diagnose the disorder. Certainly there is greater awareness than there was 10, 15, 20 years ago. And so with greater awareness means a higher rate of diagnosis, certainly. The other issue, too, is that as medical care has become much better, children who in the past had very complex medical conditions very, very early in life or during delivery, for example, may not have survived but are now surviving. But they may be at higher risk for developing neurobehavioral disorders such as ADHD.
Well, that's interesting. I hadn't thought of that option. What's the difference between ADHD and ADD?
Great question. So the current diagnostic nosology or classification term is basically there's three different types of attention deficit hyperactivity disorder or ADHD. The first is ADHD combined type, which is a combination of individuals that have a significant number of hyperactive or impulsive symptoms. In addition, they also have a high number of inattentive or distractible symptoms. The second is ADHD primarily hyperactive type, which are those individuals that have more of the hyperactive, impulsive behaviors and not so much with the inattention or distractibility. And then we have ADHD inattentive type. And so these are individuals who have more of the inattentive, distractible issues and not so much with the hyperactivity and impulsiveness. ADD is actually an old term, but using current definitions falls under the inattentive type is how I would characterize that.
It's interesting. You wonder about the recognition. I think you brought this up of are people just recognizing it more. I also hear parents, just in friend groups, use it almost in a casual term, like, "Oh yeah, my kid's got a little ADD or a little ADHD." Do you see that when we think about the actual diagnosis that might require behavioral interventions or medication interventions or both? What are those signs and symptoms that parents, rather than just thinking, "Oh, my kid's a little off the wall today," it might actually be a pattern that needs further investigation? Great
question. So the behaviors or the issues in ADHD are typically noticed in development, early in development. And you should be looking for such issues as is your child having difficulty sustaining their focus or attention on activities? Are they easily distracted? Do they have great difficulty sitting still? Are they constantly on the move? Do they not think before they act to the point that it raises safety concerns? Are they running in the middle of the street, in the middle of the parking lot, that sort of thing? So certainly there's a constellation of behaviors that obviously defines ADHD. I think the question that is also very, very important when it comes to diagnosing this disorder is, do these issues with inattention and distractibility, do these things with hyperactivity and impulsiveness cause significant impairment in daily life? That is a key question. Because we can use terms like inattention and distraction, but if I would tell you that your child has excessive imagination, just changing that terminology kind of changes how you perceive the disorder. So the significant impairment piece, I think, is very, very key.
Well, because it infers that it's something that needs to be fixed.
Right.
Yes.
Right.
Absolutely.
Are there known risk factors or?
Certainly. So in kids with ADHD typically have different brains, to be really, really basic. There are certain brain structures that are not as well developed as children that do not have ADHD. There are certain nerve circuits in the brain that are not functioning as efficiently as we would like, hence the need for medications to kind of address the nerve circuit issue. There are certain environmental factors that play a role.
Sure.
Poor prenatal care, for example, high kind of family stress dynamic puts one at higher risk, not necessarily causing ADHD, but certainly puts at higher risk. And there's also a genetic link. So if you have a first-degree relative, a parent that has been diagnosed with this disorder, it puts you at higher risk for also being diagnosed with ADHD.
Family tree.
Family tree.
Yes.
Well, and that's, I think that's, you're highlighting some important pieces that these people might be at higher risk, but the significant impairment piece, because there are a lot of people who are quite functional who lead very successful lives with diagnoses of ADHD.
They find a word. They found a world of broadcasting and flourish.
Many things.
We won't name names.
Right. And what I'm curious about is, even though you can be very successful, and often people are very successful, what are those things that that parents can be thinking about to put their kid on a successful track, either with interventions or even just thinking, is this something that they'll outgrow?
Good question. So in terms of, what I hear you saying is, what's the identification and the treatment piece? And then second, do they outgrow it? I guess I'll answer the second question first. So if someone does have ADHD, a general trajectory is if they have hyperactive or impulsive symptoms, those tend to wane as they grow older. They tend to dissipate. But typically the inattentive or the distractible symptoms persist. Now, as someone ages, they can potentially learn skills to kind of address those things without the use of medication. And so that's certainly an option as well. In terms of what can parents be looking out for, or if they're concerned, obviously talk with your pediatrician or primary care physician. In my experience, these physicians have much greater awareness of ADHD and also how to screen for it. And the screening typically takes the form of a form or a checklist completed by a caregiver, but also kind of a secondary informant. And what I mean by that is it could be a school teacher, could be a daycare, depending on the age of the child, to see if there's a presence of these symptoms in 2 or more settings, because that's also another important criteria. Kids,
not just in math class.
Exactly. Yes. Kids are ADHD all the time, right? They're not ADHD at home, and then not at school. So that's an important thing. But then again, also the significant impairment. I want to keep highlighting that.
Yeah.
I want to ask about behavior modifications, because as the mom, I just know that sugar and sleep, the 2 S's, are big factors that contribute to this. Okay. Can you speak about that a little bit?
Certainly. So in terms of diets, I've heard the sugar. I've heard about red dyes. I've heard about carbohydrates. Taken as a whole, the literature does not suggest that diet leads to ADHD. That doesn't mean that there are certain individual kids where it could have a pronounced issue, but taken as a whole, this is what the science is telling us. Sleep, on the other hand, is a whole different ball of wax. There's very compelling evidence that adequate sleep heightens or strengthens kind of cognitive skills, and that if you have poor sleep, that leads to issues down the road. So you might have someone who has chronic poor sleep that looks ADHD, but if we get them on a good sleep pattern, those symptoms tend to dissipate. I don't know about you, but if I get a night of poor sleep, it certainly affects me the next day.
Right.
Yeah, there are people who will say, "Oh, my kid's not a good sleeper because he's just so crazy ADHD." And I'm like, it's kind of maybe the other way around.
Yeah.
Exactly. Exactly. Great point.
We've been talking about ADHD in children with Mayo Clinic psychologist Dr. Michael Zaccariello. Thank you so much for joining us.
Thank you for having me.